So hydrocephalus, the only way to treat hydrocephalus really is to divert the excess fluid out of the brain before it builds up and causes brain damage and coma and all sorts of things. One of the ways is a shunt or a pressure valve, where there is a valve that opens at a specific pressure as determined by the neurosurgeon. Some valves are preset once they are in the body, and some can be set magnetically, reset from externally from the brain. The little machine sits over the valve and it changes the pressure for you, which is huge lifesaver for a lot of us who don't want to have brain surgery every time. Hey, we're moving to a higher elevation. Can we go ahead and raise the pressure so I don't overdrain or lower it or whatever it is? So the shunt valve that opens at whatever that pressure is and drains the fluid from wherever the blockage is in the brain. For me, it's in my third ventricle, but it can be put in any of the ventricles of the brain because that's where your spinal fluid is created. So they drain it from where it's being backed up, and it goes through a valve, or 3 in my case, and it drains down either to the heart or to the peritoneal cavity, to the abdomen. There are other valves and specific valves for different reasons because you're all trying to put together a shunt valve system that works best for that patient's case. So for me, I don't need very much fluid taken out of the brain. I just need just enough. So I have the shunt pressure valve. I have an anti-siphon valve just below it, so there's no backflow of fluid. And then I have what's called a gravitational assistant or a shunt assistant. And it has balls in the thing, so every time I stand up or sit up, which would normally make gravity take hold and make the fluid drain out of the brain more quickly out of the shunt, it drops 2 little balls down on that hole and prevents the fluid from just over draining automatically. So I can get up without this rush of fluid from my head. And that's been a game changer for a lot of us who have an over draining shunt problem where we just can't get the pressure high enough that it doesn't overdrain. So there are other valves too that only go up to a certain pressure or go really low for some people. It's just a wide range and several companies who make these shunt valves. And the neurosurgeon and the patient's family just works together to find, well, let's try this one this time. Okay, well, let's do this one. But it all comes down to that catheter, which is just a silicone tube connecting the valves and to get the fluid where it's supposed to go. And that tube is very small and can clog very easily with the floaties that are in the spinal fluid. So there's the shunt. Another thing is what they did for me when my third shunt failed in college. They can do what's called an endoscopic third ventriculostomy, or an ETV. And that ETV, they poke a hole at the base of that third ventricle in the brain, and it allows the spinal fluid to drain that way. To be a candidate for that surgery, there are several criteria that you need to meet because it doesn't work for people who don't have a blockage and for whatever reason their body is just not moving the fluid. It doesn't work for them because the fluid's already getting out, just not quickly enough or whatever. But people who have an obstruction, and the best case is aqueductal stenosis, so between the third and fourth ventricle of the brain, that hole at the base of that third ventricle is a lifesaver, and you don't need a shunt. Unless, of course, something else happens down the line and it's not effective enough. So there's that. So there's the shunt, there's an ETV. There's also what they do in babies sometimes is an ETV and CPC, or choroid plexus cauterization. The spinal fluid is made in the choroid plexus of the brain. It outlines the ventricles, the lateral ventricles, I think, of the brain, and it acts kind of like as the Brita filter for the blood. So it filters out the impurities of the blood through this, and that's your spinal fluid. And that, of course, it helps cushion the brain, it moves around, but if it's not moving around, it can cause hydrocephalus. So in some infants and younger toddlers, they can actually burn off some of that mechanism, that choroid plexus, and cauterize it so it's not producing as much spinal fluid. But the rub is, then sometimes they might not be producing enough. So it's always that, what do we do with them? This is often seen in Africa, in nations where they don't have access to neurosurgeons at the rate that a shunt can fail. Because if shunts fail all the time, someone in a remote village in Africa can't get to a neurosurgeon for treatment. And they go into a coma, and then what? So a lot of times when visiting neurosurgeons go to these villages or wherever, they, like Doctors Without Borders or whatever, they just, okay, the only hope for this child will be the ventriculostomy and burning off some of the choroid plexus so they don't produce too much fluid. And that's their best chance at life. And some kids, it works great and they're perfectly fine and can live totally normal lives. Some kids, it's debilitating to a degree, and other kids, it's not enough. And those usually die, those poor kids. We have a group in Africa through the Hydrocephalus Association. We have a fun support group out there. And when they were praying for me, I got a Facebook message from one of our friends out there, and he said, we're all praying for you. We prayed for you at our event. I'm like, your event where you teach families how to prepare for the end of this child's life. Your events where you're talking funerals, not the best shunt valve for your child's condition. Like that, it just broke my heart that was what they have to face. And they were praying for me, where I have like 10 different hospitals I can show up at, and any of the neurosurgeons know exactly what to do with my case to a degree. They say, okay, well, let's replace the shunt and move on with life. And hey, if that shunt's not at the just perfect pressure, just come on in, we'll readjust it, no problem. And yet here are these families praying for me. Very humbling. And very grateful that here in the States we have so many options, especially here in Utah. Our neurosurgeons are top of the line. They know what they're doing. And they can help us all. Other ways to treat hydrocephalus could be, some people have noticed that diet and exercise can help, because if you are overweight in the abdominal area, that is going to affect the physics of how the fluid flows through your catheter. So some people have found that losing weight and staying active helps move fluid. Others, it does nothing but helps you feel good about yourself, because it's such an emotional condition. And if you're down all the time and gaining weight because you can't get up because you're overdraining or whatever, it affects you a lot. So having control of any part of your body, but especially the health of your body, through diet and exercise, that helps a ton. A lot of times with brain surgery, you can get PTSD. You can have post-traumatic stress from surgery after surgery after surgery. A lot of patients do well with antidepressants and anti-anxiety medications. Sometimes those are required just to rebalance life while your body heals from brain surgery, let alone several in a year. There are other medications out there that some people have been toying with. Diamox is one, acetazolamide, Diamox. It's a diuretic, I believe, but it affects how much spinal fluid is created. So it lowers the amount of spinal fluid your body creates. It reduces it. Some people have found success with that. I felt like all the side effects were just too much for me, and it wasn't exactly what I needed. It was either too much or too little, so just like a shunt. I'm like, what's the difference between this and a shunt? I didn't see one. But this last October, a friend of mine who suffers from pseudotumor cerebri, or a condition that affects the spinal fluid in your brain. It's pseudotumor. It's like a tumor is in your brain, but it's not considered hydrocephalus, but it does affect the spinal fluid. She had a family practice doctor who diagnosed it, and he said, you might do well. I've heard tell that this diabetes medication off-label can help with this somehow. We don't know if it reduces the production of spinal fluid or if it increases the absorption of it, but it's worth trying. It's that, or I send you to the neurosurgeon and he can give you a shunt. You can have brain surgery after brain surgery or not. It's your choice. So she chose to try it. It's Metformin, just common diabetes medication. And she's been doing well with it since 2003. When a storm comes in or when the barometric pressure drops, she takes an extra one, and that helps any headache that she might spike because of a storm. So in December of this last year, I decided to try it, and I was on it for 3 weeks, wasn't sure if I liked it. I didn't notice a difference, but we were pretty sure my shunt wasn't working consistently. My ventricles just kept filling up with fluid, and then it would kind of calm down, and then it would do it again. I'm like, oh, this is so painful, and this emotional roller coaster is driving me crazy. I'm like, we got to replace this shunt. It's not working consistently. We don't know if it's clogged or whatever, but then when I brought this up with my neurosurgeon, I'm like, can we just try it? Like, what's it going to hurt? It's going to hurt my blood sugar levels? Great. So I'll eat more sugar, eat more carbs, and possibly not have any headaches anymore. That sounds great. Let's try it. So we did, and 3 weeks into it was when I noticed that my daily headaches were calming down. I was still tracking barometric pressure. I was staying at the same elevation. We didn't go anywhere for a month, and I was doing great. And all of January of this last year, I was completely headache-free, dizzy-free. My vision was clear. It was amazing. No nausea, no nothing. And so I was sold. But then we changed the variables. We went to a visit in California for a couple days, and that kind of threw me off, and had to get back on track. And it's been rough trying to recover from that. And then my grandmother died, so I went back to California. And so it's just been, there's life. We have to live life. And you're trying to control as many variables as you can, but there are some that are out of your control. So I would say that the metformin has helped a lot, but it's not perfect, and it works for me because, again, my spinal fluid still gets out of my brain through that hole they made back in college, but just not enough. So we think the medication is either reducing or helping absorb just enough that I'm pretty comfortable and I'm pretty functional most days. I wouldn't say 24/7 at all. We are not even to say that, oh, I feel great most of the time. Most days I don't. I have several hours in a day where I feel productive and like I can be a mom and a wife and do life and have fun with my family, but other times it's, honey, you got dinner again? Good, because I'm checking out for the night. I can't do anything. I can't even think through processes anymore. So it's been a ride. It's been interesting.